Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the RNs in home health and hospice nursing. It's just a quick overview to get you to understand this nursing role. By the end of this lesson, you should be able to describe the history of nursing in home care. You should be able to compare different practice models for home-based services. You should be able to explain the professional standards and educational requirements for nurses in home health and hospice. You should be able to explain how nurses in home care work with interprofessional teams. You should be able to analyze reimbursement mechanisms, issues, and trends related to home care. Recognize how nurses in home care use quality improvement strategies to promote client safety. You should be able to assess trends in home care as related to promoting and the achievement of national health objectives. You should be able to describe key components of the Omaha system or even just a quick overview of it. The home health and hospice nursing roles are different from other healthcare practices that nurses work in within the community because the healthcare provider is in the client's home. It is unique and characteristics that affect this setting, including establishing trust, developing care partnerships, selecting interventions, and collecting outcomes and data, ensuring client safety, and promoting quality takes on a whole new meaning. Family members in this setting, including the caregiver, it could be a significant other, a friend, they take on the responsibility to assist in meeting care outcomes, and they are a very big part of what you're doing in the home. Home health nursing care has its roots in public health nursing with an emphasis on health promotion, illness prevention, and caring for people in the context of their communities. Home health and hospice reached a turning point with the arrival of Medicare, which has provided regulations for certain forms of home care and practice model and reimbursement mechanisms. The next thing we're going to talk about is home health practice models. Although many people think that home care is all people do as far as home health nurses or hospice nurses, there are many other approaches to home care. There are actually 5 models of practice that are described in this lesson that I want you to understand. The first one is population-focused home care. This is where you go into the home care setting, intervening for a population problem. I will think about this as well, child visits by the home health nurse, focusing if you have an area where there are outcomes that are of concern regarding children after they've been discharged from the hospital, you may have a home health nurse that's assigned for population-focused home care. There's also transitional care in the home. This is transitioning from an illness in the hospital to the home setting, and the nurse is going to go in the home setting and provide transitional care at home. The third kind is home-based primary care. This is when a patient is in the home and requires ongoing skilled nursing services and they need a nurse to come in. The fourth is home health and then hospice care. Home care nurses should learn about the current and new models of home care and use those that are the most effective for this situation. There's different ways to approach home care, and it's just not all home health. Home health agencies are also divided in different categories. I highlight 5 categories, and these categories are established on the basis of administrative and organizational structures. So you hear people call it an official home health agency, or a private and voluntary home health agency, or a combination of both, or a home hospital based, and then you also hear about proprietary home health agencies. Standards of practice for home health agencies are going to come from the ANA and other specialty organizations. Nurses must demonstrate professional competencies both as a home health and a hospice nurse, the home health care practices in accordance with the scope of standards of home health and nursing practice were developed by the ANA and together with the Council for Community Health Nurses. Hospice nurses use the scope and standards of hospice and palliative nursing practice that were jointly developed between the ANA and the Hospice and Palliative Care Nurses Association. Okay, interprofessional collaboration in this regard is very important. In home care settings, home care is associated with a lot of overlap, so collaboration is key in being able to make sure that you provide the best care. Since the advent of Medicare, home health and hospice agencies have strict monitoring and mandatory requirements for what entails of what a nurse does in the home. There's a lot of challenges that nurses in the home health and hospice face that they must be accountable to regulatory guidelines. The OMAHA system was developed and refined through a research process. It's reliable and has passed. It's a valid instrument. The Omaha system is unique in that it provides comprehensive vocabulary that was developed by population-focused nurses, and it's designed to provide specific principles for how a home health nurse functions in the home as far as taking care of people from an individual, family, or community or systems perspective. RNs come to home health and hospice from a variety of educational and practice backgrounds. The differences in experiences in education preparation influence the contributions that they make to this. Home health and hospice nurses should be educated to function at a high level of competency so they can be relied on, and not only by their professional colleagues but by their community. A BSN is the minimum entry requirement into the community health setting that is preferred. You will see some home health nurses coming in below a BSN, but they prefer that you continue your education and you get your BSN. We also like for home health nurses to have certification in home health. The American Nurses Credentialing Center provides that two credential options. The first one is Advanced Public Health Nurse, which is a PHN, or you can also have a PHN CNS BC, which is a public health nurse, clinical nurse specialist, board certified, and you can also have an advanced public health nurse that's board certified as well. As far as trends for the future, I want to talk a little bit about the OASIS, Outcomes and Assessment Information Set. OASIS measures the outcomes and quality and improvement client satisfaction with the care that's provided, funded by the Centers for Medicare and Medicaid Services and the Robert Wood Johnson Foundation. OASIS went through an extensive testing and to make sure that the nurses know how to use it, because nurses are working with clients and families in the home setting. They're in a position to promote and achieve some of the key objectives of care, including the Healthy People 2020 objectives. So these nurses can assess the client status and can drive population-focused objectives effectively. Thank you for listening in to this lesson. I hope you have enjoyed this overview of the RN nursing care for home health and hospice nursing. If you have any questions about this lesson or any of the corresponding notes, please feel free to email me. Have a lovely day.